my name is Joanna, the nurse, and today Luke and I are going to talk about a very popular topic that I get asked questions on quite a bit, and that is on non-surgical nose jobs. So I think this is a procedure that is game-changing and that looks amazing on the right candidate. This is actually going to be the last episode of Joanna, the book of Joanna the Nurse, Volume 2. I filled up all the pages, so the next time you see it, it's going to be Joanna the Nurse, Volume 3. Okay, so be excited for new content. Okay, so the first thing about non-surgical noses that a lot of people ask me about, it's what's the basic idea behind it? How does it work and how can it transform one kind of nose to a completely different kind? So basically the idea behind it is that you're using filler to camouflage bumps or to build bridges. So basically people with flatter noses or people with big, higher, you're so loud. So people with higher bridges, but they have a bump, you can use filler to kind of camouflage that. It can also help lift tips and that are droopy or that when you smile, it kind of looks, sometimes people call their nose this, but like a squiggly nose. So it can lift that up too. However, it really depends on the patient, your skin type, and what you have to start with. So always keep in mind that a non-surgical nose job is not a surgical nose job, which is something I constantly remind my patients about because there are a lot of limitations. Things that I cannot help with include actually narrowing the nose. So people always ask, can it make my wide nose thinner? And it actually cannot. However, when you are creating a higher bridge, you can get the illusion that your nose is a little bit slimmer because it is taller. But physically, we are not narrowing the nose bridge. Also, we cannot physically make the nose smaller, so that is a question I get asked quite a bit. However, that is going to be with surgery again. However, by building up that bridge or by helping smooth out a bump, it can strangely create the illusion of a smaller nose, so it's great. Let's see. Okay, another thing that I can't do is it cannot correct the asymmetry for very crooked noses. So some people have crooked noses that are very crooked, so you cannot correct that. So I just want to give you that heads up. So this is, I guess, a generic video on non-surgical noses in general. So all doctors will use different fillers just based on what they prefer and what they're comfortable with. I tend to use Voluma. Voluma is a product by Allergan that does last up to 2 years, and it is a hyaluronic acid filler. So if for some reason something happens or you want to dissolve it, you can because it is a hyaluronic acid filler. Ooh, that's your Ella. Okay. One thing to note also is that there is no FDA-approved filler for noses, but don't let that scare you away from getting it because in reality, there's no FDA-approved filler for chins or under eye, but yet it's so commonly done. So I do tell patients it is off-label, however, it is very popular. And again, Voluma does claim to last up to 2 years, however, realistically it does last just based on the patient. The more you work out, the more hot yoga you do, the faster your metabolism is, the faster it does tend to go away. So just a few heads up that it will not 100% last you 2 years. Some people it goes away a lot faster and some people a lot slower. So it just kind of depends on your nose. Lukey. Hi. Okay, so this is a question I get asked quite often. Pain level is minimal to none, actually. So a lot of my patients, they don't just get their noses done with me. They get a lot of other things done, such as their lips, cheeks. Lukey, lion. Most people actually say the pain level is either a 0 to 1 to 2, maybe, if that. Most of the time, patients don't even feel it. However, patients do have different levels to their pain sensitivity. But again, it's pretty easy, especially on the bridge area. The tip is a little bit more, Lukey. The tip is a little bit more sensitive. However, babe? Say hi. Okay. Okay, if you are sensitive to the pain, just know that I do a topical numbing cream, and also there is lidocaine inside of the injection as well. So most of the time, patients, even if they feel it initially, after a while, they don't feel it. So safety issues. So this is something that a lot of people do ask me about as well. And it's just important to note that filler, even though it's elective and cosmetic, there are risks associated with all different types of fillers, all different types of procedures. So I think it is important for patients to be aware of that. Probably the most, I wouldn't say common issue, but the most severe issue that can arise with a non-surgical nose job is an occlusion, where basically the filler occludes a vessel and it lacks oxygen, and then it can cause necrosis and the tissue can die. That sounds really scary, and it is. However, it is extremely rare. So when going into this procedure, know that yes, complications can arise. However, most injectors, pretty much all injectors at least, should be trained on how to look for signs of an impending necrosis and what they can do to reverse it. Don't let that scare you from doing, any kind of procedure. However, just know that with anything, there is always a little bit of risk involved. So I just want to give you that heads up. It's a combination of mom life and trying to do a YouTube life. Okay, sorry about that. So basically, yes, there are always safety issues to take note of. However, there are things that we can do to combat the issues, and also things we can do to hopefully prevent the issues from happening. You can go to the best injector in the world, the worst injector in the world, and honestly, it could happen to both of them. So, as long as we know what we can do and we can reverse it, then it goes from there. Next, recovery and aftercare instruction. So most people ask, how long does it take to recover from a non-surgical nose? In reality, most patients do really well. The majority of the patients that at least I see do not bruise. However, they all do swell a little bit just because the material does swell. So I just want to give you that heads up. Couple of things to take note of is do not work out for at least 24 hours. Do not wear glasses for at least 24 to 48 hours, ideally longer if you can. And also do not sleep on your face for at least 1 or 2 nights. That's super important, just because the filler, at the end of the day, is just filler. So we're not actually shifting bone, we're not moving anything, we're not cutting any skin. So just know that it can move. However, it's less likely to, as the filler just stays in there and just kind of progresses. Let's see. So let's talk about my training. So a lot of people ask me this as well. How are you qualified to do non-surgical noses? In reality, any aesthetic nurse technically can. Whether or not they should, though, it kind of depends on their training. My training is I am trained under a board-certified plastic surgeon, Dr. Peter Nguyen, and he has been doing rhinoplasties, both surgical and non-surgical, for many, many years now. So he really, yes, even though I learned about anatomy in school, both undergrad and graduate school, really he showed me, and he just really taught me pretty much everything I need to know about non-surgical nose jobs, and I credit a lot of my skill to him. I actually trained for over a year before actually injecting patients. And actually at the beginning, I didn't think that I would inject non-surgical noses. But, to be honest, that, after injecting for quite some time and feeling a lot more confident in myself, I thought, why not do it? Because honestly, I think that I think I could be really good at it. So I am very proud of my noses that I make. Again, it is just filler, so it's not some magical technique or anything like that. But I do put a lot of detail into my noses and pretty much all the things that I do to make sure that my patients look as good as possible. So ending thoughts for this video, a couple of things is non-surgical noses are a game changer. They really can help someone's appearance and just really build someone's confidence up. And I think for me, that is the most rewarding part about doing pretty much my job in general. A lot of people aren't aware that non-surgical noses, it's pretty painless and it's relatively affordable, especially in comparison to a surgical nose job. So just some things to note. So does this actually replace surgery? It does not just replace surgery. However, for people that want just that minimal correction, or for people that kind of want to see how their nose looks a little bit different, this is a great starting point. Some of my friends and some of my patients told me that they were debating a nose job for years, but then after seeing a non-surgical nose, they were thinking, I could just continue doing this and I'll be fine, you know, because their nose isn't that bad where they want to surgically correct it. However, they do want to, you know, adjust certain things about their nose. So again, with my job, yes, some people critique, you know, changing faces, things like that. However, the way I see it is, if you don't like it, why not kind of, you know, change it a little bit, just because really at the end of the day, it's your face. So, you know, people can say what they want to say, but it's your face, probably your money, and happy to help in any way I can. And again, if you're considering it, definitely just go for it. Come see me. Consultations are complimentary, and you could see some of my work on my Instagram, which is Joanna the Nurse. Follow me there, please. And then, yes, I think that if you're contemplating it, if you're watching this video, the chances are you are contemplating it. So go for it. Thank you guys so much for watching. I hope you guys enjoyed this. I'll see you guys soon. Bye.
Bye.
Bye. Blood kiss. Say good night.
Nine.
Night night.